with the necessary hospital statistics available to the local communities, by the local hospitals, one can identify if most of these diseases are lifestyle or even preventable kind of diseases. So, which brings us to the questions around food and lifestyle diseases specifically. Uh, what are lifestyle diseases, and what can we? I mean, can you sort of give some examples of it? That are sort of common in most cases.
Okay. So from the word lifestyle, you can already deduce what it means. These are diseases which you develop as a result of the lifestyle you eat, as a result of the diet that you are exposed to. So these are the most commonest diseases we deal with in our community, because in terms of diet, we're looking at our hypertensions, high blood pressure. You look at the main cause of hypertension in our community is high salt intake. That's why our community consumes a high amount of salt, and that's why they develop hypertension. Secondly, you have diabetes. Obviously, there's two types, but most high consumption of sugar products might lead to that. We also have our malarial pain, they are known as coronary artery disease. High consumption of makula fats, they lead to clogging up the pelo. Those are more dietary diseases. And then we have others which are like more lifestyle, like your smoking. Smoking is a lifestyle habit that leads to diseases such as also hypertension. It's a risk factor for hypertension. It's also a risk factor for heart disease. It's also a risk factor for the stroke. You look at another lifestyle habit, which is alcohol. It leads to chronic liver failure. It leads to also chronic pancreatitis. So as you can see, these are diseases which without these contributing factors would not necessarily exist, but because of the diet and the lifestyle that contribute to it, that's why you develop these lifestyle diseases. You can also say HIV is a lifestyle disease because of the sexual lifestyle one is practicing.
Some great answers there. So it's unfortunate we have to leave it here, but before we leave, this will lead us to maybe our next episode. It might be third or fifth or 100th episode. Since you're interested in sort of like giving the quality services to the general public, maybe the question we should ask the public to engage is, where do we get the funding, and then how to sustain it? So we will be having the next talk with related to that. I mean, how can we finance it, the sustainability behind it? Otherwise, we had the beautiful one, man. Until next time, I think this was great, and then I'll be glad if all of you, the South Africans, you are engaging in this kind of conversations. Until then, we'll see you next time. Thank you very much, Dr. TP Moswane. Keep well, man.
No, thank you.
Be safe.
Looking forward to the next one.
Okay, sure, man. Thanks. Sharp.